So, good morning, everyone. Today we are going to discuss about the topic removal of gonads and abortions in reproductive biology in the system. So, I myself Anirudh KA. So, we are going to discuss about the methods of removal of gonads and abortions, methods of abortions, matters that need to be looked on by considering abortions. Okay. So first of all, in our first slide, removal of gonads. So we all know that gonads are a significant part in our endocrine system, releasing hormones such as testosterone, estrogen, progesterone, etc., and their role in development of secondary sexual characters. So here we are going to discuss about the methods of removing gonads for certain reasons or certain purposes. Okay. So the methods include surgical procedures such as orchidectomy, which is the surgical removal of testicles, and oophorectomy, which is the surgical removal of ovaries. So these surgeries are typically performed by trained medical professionals in a hospital or surgical setting. The specific method may depend on the individual's health, individual's medical history, the reason for the procedure, and the other factors. Okay. So first of all, orchidectomy or testicle removal. So orchidectomy or testicle removal is a surgical removal of one or both the testicles. Okay, it is often done in the cases of testicular cancer, and also to reduce testosterone levels in transgender individuals undergoing gender confirmation surgery, or also to address certain medical condition. And the procedure includes making an incision in the scrotum or the lower abdomen depending on the result for the procedure, and the testicle is then carefully removed. So the procedure includes making an incision or cut in the scrotal region or the lower abdominal region depending on the reason for the procedure, and later on the testicle is then carefully removed. So these are the purpose and the procedure of the method of testicle removal or orchidectomy. So likewise, ovary removal or oophorectomy, it is the surgical removal of one or both ovaries. So it is also like performed for various medical reasons such as treating ovarian cancer, managing conditions like endometriosis or polycystic ovary syndrome. Because polycystic ovary syndrome is a medical condition in which multiple cyst outgrowths can be seen in ovaries. Okay, so it is also oophorectomy is also used to treat medical conditions such as these. It is also used in gender confirmation surgery for transgender individuals. The procedure includes oophorectomy can be done through traditional open surgery or minimally invasive techniques such as laparoscopy. The surgeon removes the ovaries, and also in extreme cases, the fallopian tubes or oviducts are also removed. Both orchidectomy and oophorectomy are significant surgical procedures that have medical implications because as they are the gonads, also as they control the release of sex hormones, the removal of these organs may lead to further serious implications. So these methods are only considered after serious discussion with the qualified healthcare provider. Okay, and also the individual's health and medical history is scrutinized to check the method is whether the method is apt for the individual or not. And after all these discussions and considerations, these methods used. Okay, so moving on, we are going to talk about abortions. So what is abortion? You may all know that abortion is the medical procedure performed to terminate a pregnancy. Okay, so abortion can be seen illegal, or it is considered illegal in many countries, but in India under certain conditions it is considered legal. Okay, so under the MTP Act, Medical Termination of Pregnancy Act 1971 in India, one can abort during the first trimester under the supervision of a certified healthcare professional, and also can abort during 20 to 24 weeks under the supervision of two healthcare professionals. Okay, so here we are going to discuss about the methods of abortion. So the methods used for abortion can be broadly categorized into two main types: medication abortion and surgical abortion. So the medication abortion means usually involves taking medications or pills, which are usually a combination of mifepristone and misoprostol, which are it can all be taken under the supervision of a healthcare provider. It is effective in the early stages of pregnancy. So you should note that medication abortion is only considered in the very early stages of pregnancy. Okay. Then moving on, surgical abortions. Surgical abortion, as its name implies, it is the method of abortion using surgical means. So its various types are vacuum aspiration and dilation and curettage. Vacuum aspiration is the method in which it is as the method in which suction or vacuum is created to pull out the fetal or the contents of the uterus. Okay, it is used in the first trimester of pregnancy. Involves suction to remove the pregnancy. That is the method of vacuum aspiration. Dilation and curettage is the method used in the first trimester period and also involve dilating the cervical region or cervix. Dilating the cervical region or cervix and scraping the uterine lining. Okay, the lining of the uterus is scraped out by after dilating the cervical region. This is the method of dilation and curettage. Next is the method of dilation and evacuation. This method is usually used in the second trimester of the pregnancy or gestational period. It involves dilating the cervix and remove the contents of the uterus using suction and medical instruments. Okay, it is used in the second trimester of pregnancy period and involves dilating the cervical region and then removing the contents of the uterus using suction and other medical instruments. Okay, this is the method of dilation and evacuation. Next is the method of induction abortion. This involves the use of medications. Okay, medications are used to induce parturition or labor, then thereby terminating the pregnancy. It is the more commonly used in which trimester period? Second trimester period. Okay, so dilation, evacuation, and induction abortion is used in the second trimester period, and surgical methods which are vacuum aspiration and dilation and curettage used in the first trimester period. Medication abortion is used in the very early stages of pregnancy. So one matter which needs to be considered very important is that abortions are a very serious matter to consider. Okay, so it needs to be done in a safe and legal environment and also under the supervision of certified healthcare professionals. These are two matters that needs to be greatly and seriously considered before undergoing the procedure of abortion. We need to look upon a safe and legal environment so that we do not have further serious implications in the future. And also it needs to be done under the supervision of certified healthcare professionals, so we do not have further damage in our future. Okay, so these are the main things that are considered or discussed in the topic of abortion. Okay, what is abortion, methods for abortions, and the general implications, okay, before considering abortion. So after various or heavy scrutinizing of the individual's health and medical history, needs to be the matter of abortion discussed and done. Okay, so we have come to the conclusion of this topic. So here in this topic we have discussed about the removal of gonads and different methods for abortions. We came to know about the gestational period in which each method of abortion can be used. Okay, so also we came to know that through this project we came to know that these methods these methods should only be done in a legal and safe environment and also under the supervision of certified doctors. So as responsible adults of our country, we need to look that abortions can only be considered under the supervision of certified healthcare professionals and need only be done in a legal and safe environment. Okay, so these are the things which are discussed in this topic, and that concludes our topic. Thank you.